Right. Good morning, everybody. I think we can start. Just a quick housekeeping rule. So we will have our webinar session now between 11 and 12. We will try, I know that was originally scheduled for 11 to 1, but we will try and conclude the feedback and the engagements just within this hour. There is some flicks, just 15 minutes on the 12 o'clock side to 12:15 before I also need to just step off and join another urgent engagement. I think first we'll just go through some welcome, and then we'll just run through the agenda. We'll give some feedback and think specifically just on some key topics that we wanted to touch on today. Hopefully not spend too much time on that, so that we can just create a little bit of space at the end of the session to do some questions and further elicit some feedback and input. Right. I think, Ntokoza, you can, or Mel rather, you can stop sharing and I can maybe just call up my presentation and we can jump straight into it. Sorry, it's just busy loading. Just let me know as soon as everybody can see that.
Yep, it's up.
Good stuff. Alrighty. Great. Right. So I think, yeah, just welcome everybody. Thank you for making the time to join us for the Section 21 discussion today. We just wanted to go through some of the nitty-gritties around user account registration. Just briefly reminding everybody around those mechanisms that's available at the moment for named patient and multiple patient applications. And just some of the changes that has been introduced on the back of the global benchmarking that has been conducted with the likes of TGA in Australia, Health Canada, US FDA, and the MHRA. Also, just to provide some feedback on inputs that we received from various stakeholders during last week, and then just a playback of those particular topics to the rest of the folks that have joined the webinar session today, and give then some provisional feedback in terms of the internal discussions that we've had on the back of all of this input and feedback. And then, as I said, hopefully we can also then have some time just for further discussion. So first things first, just looking at our user accounts. So just to flag for colleagues that are coming from public healthcare institutions, whether that's a hospital or a clinic, it's really important that when you create your user account, you create that as a public health institution in order for us to link the correct pricing structure to your accounts. There's a few, I think I saw last night, 3 or 4 entities that are public healthcare institutions that have not linked themselves to a public health institution practice or clinic. And as a result, we've got an incorrect pricing structure that's now pulling through and creating a blockage for that order to move through to the Section 21 review. So I think what I will also ask Shamli to do is just specifically connect with you during the course of today. If you already know that you might be one of those institutions that have created an account and you've tried to create an order and it's now given through a priced order, you will need to re-register an account, but then select a public health institution. Unfortunately, we cannot make that change retrospectively. We will have to recreate the account and recreate that specific transaction in order for it to then run through the system correctly. For private companies with different hospital sites or different pharmacies that should reside basically within a corporate account structure, we would want to encourage that you use the private companies option and then select other as the further drop down option. Um, Here within that corporate account structure, then you can create your different sites or pharmacies as divisions within the corporate structure. And within that division or site, it also allows you the opportunity to then create different users at a site. Um, Now, as we've said at the onset, it's important for us from an ICT governance perspective that each user is linked to a unique email address. Um, and what we can give guidance on is we know that sometimes your pharmacy practice or your pharmacy at your hospital facilitates the administration around ordering the stock as the pharmacy on behalf of some of the healthcare practitioners within the hospital. And the suggestion at this stage is as you perhaps have then your pharmacy admin group email address, that for that pharmacy admin group email address, that your ICT teams assist you to create aliases that will still link it through to that same user account on your Active Directory. We're mindful of the fact that you cannot just go and create users and users and users. For us as well, we obviously mindful of the cost implications of that. But certainly, setting up the aliases should be something that your ICT team can assist with. And as an example, we just have, for instance, a Dr. Naidu dot pharmacy admin at hospitalgroupa.coza. And your second healthcare practitioner that you're supporting might come in as Dr. Moot dot pharmacy admin at hospitalgroupa.co.za. And you can load those various users on then basically your site or division. Ultimately, all of the email correspondence will then run through pharmacy admin at Hospital Group A as in the user account, so that you can continue to facilitate and administer the account. I think the now I've lost my train has gone off its track. But for this, there we go. So for the user accounts that is then the healthcare practitioner, basically, it's important to capture the healthcare practitioner's details. And then, as I said, just add this communication mail address so that all of the correspondence flows through to your administrative support team. And the reason for that is when the application itself is done on behalf of Dr. Naidu or on behalf of Dr. Moot, as examples, that user will be used to then apply for the account. The application. And that is so that on that application, the account details for the healthcare practitioner, being the HPCSA number, etc., pulls through correctly on the application form, which will then satisfy the requirements that we have in line with our guideline and procedures to process that application for the healthcare practitioner ordering product A for patient B or patients A, B, and C. I hope this provides some guidance and clarity. And I mean, I think just this is the provisional thinking. As I've indicated, there is some feedback that we are still unpacking with the support team and with some of the internal teams. For individual doctor practice accounts, these now where the individual healthcare practitioner is responsible for that application within his practice. That healthcare practitioner is also responsible then for submitting those outcome reports. These should be then set up as practice account. So they can either be set up as individual accounts or again using the option of private company other, within the main admin user can be loaded, whether that is somebody in the practice itself that is responsible for account administration, facilitating the ordering process, and then a second user can be added to that specific account, which will then be the healthcare practitioner itself. And again, when the application is done, it's done under that healthcare practitioner's account so that the correct credentials and information pulls through to the application itself. So this is just the screenshots to kind of anchor ourselves around what this looks like when you step through that navigation. So for organizations, these are the kinds of organizations that we have at the moment. And as indicated, this is something that is currently being reviewed and scoped to see how we can improve and make this a little bit more user-friendly and also align well with the input and the feedback that we've received. Under public health institutions, these are then our options. So for all of our public health clinics and hospitals, you will need to register your account as a public health institution and then select option hospital/clinic in order to facilitate correct pricing calculations. For our private companies, this is what that private company screen looks like. So here, as I said, you would select other and then proceed to create your corporate account. We also have private healthcare institutions, which primarily, I think, as we are talking orthodox and biological products at the moment, being the target product category for this first phase of the rollout, that would reside with your hospitals and clinics primarily. So just creating that private company account, if you select other, you basically, for colleagues that have already done that, that's familiar with the screen, you typically get this first screen to fill in where you are asked for the private company's name. You can fill that in there, your address, any additional information with regards to the building or the address. And here it then asks you for a number, whether it's professional body number or registration number or practice number. In this instance, as I've selected private company and I've selected other, I am just capturing my CIPC number and attaching then the relevant CIPC certificate. So again, something that we'll do is just to improve the labeling. So for that broader semantics to then display as you run through these options. But there are no blockers here in terms of mandatory fields other than you are supposed to populate the organization's name. Personal information here again, run through that. When it asks you for profession, you can select other. And then here, if there is no specific professional body number that applies, to mark that office not applicable. If you are, however, the pharmacist registering on behalf of, you can fill in your pharmacy council number there, and then just select a date into the future. And again here, if there is any documentation that you can upload, either healthcare practitioner's registration or pharmacy council, or those probably would be the two relevant ones. And then just your contact details to create your account. And that basically gets you on your way to set up your corporate account structure or your private company structure. And then from here, once you've verified your account, you can then start going into your dashboard and setting up all of your different sites or divisions, whether that's different pharmacies or different hospital sites that you want to create, or different hospital practices or different practitioner practices that you want to create. You can basically manage it this way. Right. Then I think just some feedback, an update on some of the inputs and engagements that we've had during last week. There were some discussions, largely with representatives from the radiopharmaceutical industry, as well as some of the contacts sessions that we've had with colleagues within the private hospital group sector. So provisional feedback that we can share at the moment, after we've also onboarded some of that inputs and have been able to set up a briefing session with our senior management team. We will, for following that meeting, be looking at a tiered pricing structure that can be implemented. So that also has an impact on the guideline that would need to then be updated to reflecting these three different tiers. Here we would primarily then have your named patient applications, which will then remain as described, the named patient applications for multiple named patients, and then a third structure or a third tier, which will be multi-pack applications for hospitals or treatment practices. And there, primarily, the focus would be on the reason coding for requesting said Section 21 application, ring fence to applications for out of stock products. Example there that we've discussed is the magnesium sulfate, which is currently problematic for discontinued products or products that were previously registered in South Africa and have now been withdrawn from the market. You're an example in the Philippines. For emergency or hospital stock items, such as the urgent treatment for multi-drug resistant infections, like with colistin, and for diagnostic or one-off administration, whether this be radiopharmaceuticals or, in the case of, again, hospital practice, phenobarbital by means of example. So we would have then definitions in the guideline that would describe this as an application, being named patient. We would have definition around named patient applications multiple. So it would be the number of patients times the applications that would then be bundled and facilitated through the current process. And then a new third tier, which would then deal with multi-pack application, which would then be for our hospitals and treatment practices. These would be the reason codes that we currently have that we are assessing and applying ourselves to developing then a pricing structure for that. Right. As I've mentioned, following now the discussion that we've had, we were able to brief the senior management team yesterday. We have been also tasked to just prepare a formal use case presentation to then come back with the updated guideline, as well as then the use case that can be presented for formal review and approval. We also will be continuing discussions with our development team just to align then system enhancement scoping in line with the current thinking and in line with the current proposal. And this will be ongoing for the remainder of the week. We then have a feedback session set for 22 April. And once that decision has been secured on this proposed approach, we will then be able to proceed with completing system developments, the guideline to then be published, as well as then facilitating an alternate flow of events management process for urgent applications where we've got multi-pack applications that needs to be managed through the multiple patient application mechanism. So there will be a specific process that we then also detail in that communication to be issued 22-23 April. for facilitating those kinds of requests, and then just ensuring that what the pricing structure is that is applicable, we can apply that, even if that is then through a deviations process that we can manage and log internally and keep record of. And that, I think in a nutshell, just the feedback from my side for section 21 and where we are, and just reflecting on some of the feedback, as well as then the current thinking around tackling some of the challenges that has been raised with us. Let me just stop sharing, and then we can maybe just go to, I don't know if anybody's popped any questions in the Q&A. Let me just start there first before we do hands. All right, so no questions in the Q&A. All right. Let us then do questions for the hands. Ntokozo, would you assist me just to unmute the colleagues as I call out their names, so that we can just take a few questions from the team that has joined us in the next half hour. And hopefully we have a chance to get through all of these questions. Please also do feel free to pop anything in the Q&A. Also happy to look at those ones. Right, and of course, our first colleague is Mornay.
Morning, Tristelna. Thank you so much again for the update, and specifically now on section 21. I must say I'm very delighted with the strides that we made. I just want to understand a little bit more on the registration and the email addresses, your slide 3. We obviously, I spoke from a private hospital perspective, so we will set up our hospital then as a corporate account and every pharmacy then as the sites. But our doctors don't have email addresses within our hospital group. Is there a way that we can find a workaround there? Because I'm just not, if we can get sort of a little process flow or so, so that we know that the communication is going to the right person. The other thing that just troubles me with that setup as well is the invoice that's been created. Will that be in the name of the site or the group or the user?
Thanks, Mornay. So I will also ask Cornel to jump in here, but I think in terms of the registration, let me start off. So yeah, I think the corporate account within creating the pharmacies as the different sites, all happy with that and aligned with that thinking from your side. I think in terms of then the individual doctors within the hospital that the pharmacy supports by placing the orders and facilitating just the procurement of these stock items, this I think is where, as I've indicated, what we are proposing is that for your pharmacy, as they have their usual, let's call it pharmacy at, let me call an example, pharmacy at arcadia.co.za. So as that is your typical user account for your pharmacy practice, the request is that your ICT team creates aliases for that same account, but then to specify these other users or doctors as part of that alias, so that we have 3 distinct email addresses to log to 3 users on the system, because it's important for the application itself to come from the healthcare practitioner, even though it is facilitated by somebody else that is supporting them administratively. So I think I can maybe then ask Cornel if we can perhaps create some sort of a little guide that we can share with the team so that they can internally have discussions with their ICT colleagues and just step them through how we propose this gets managed, because each user account requires its own unique email address. Cornel, I don't know if you have any
Yeah.
reflections on that or suggestions maybe.
Happy to jump in. I think what Christian explained in slide 3 is kind of the edge cases that we've picked up. So the most simplest form is if you are hospital group X, go and create your corporate account with your CIPC number and then start adding users. So doctors, pharmacies, whoever needs to actually apply. There is also the ability for the subdivisions if you want to group it a little bit further, but try and keep it as simple as possible. Have your group and then add the different doctors or receptionists or pharmacy users. Those users on the system needs to be unique. So that's where the alias component comes in. So there might be 90% of you where you don't have to go and create the aliases necessarily, but that's the principle. So that's just something that came out that we wanted to highlight. And then to answer your question, then for the order itself, the sales order or the invoice, not formal invoice, but the sales order, that will then be issued in the name of the hospital group with the actual user's details that did the actual application. So if the group does the payments, then ideally that sales order needs to be in the group's name. So hence following that structure. So just a little bit more repetition and detail on what Christelle already discussed, if that answers your question, Morné.
Thank you.
Okay. Right. So I think Morné, also as we bed down this revisions on the user account management, certainly it would be critical for us to do also then further update the guidelines. So we'll continue to communicate to you guys on that. And I think just this short little how to start chatting to your ICT teams.
Well, sorry, Christel, just before we move off that point of setting up for group structure, if we have now existing users in the system, and we now start to create our corporate structure, will that have an effect on it? Will it be a problem if, for example, I start now to create group structure, but that user is already in the system that I link to a site?
So I can take that one. So Morné, if they already have applications against their name, we will then just have to assist you to move them across. So yeah, perhaps log a ticket and we can
migrate
or whichever the case might be. So it's if there's no applications done yet and they've been created, we can soft delete those users and you can just start the setup from scratch. If there are users with applications against their name, once you create the new organization, it's going to say the user already exists. So just get in touch with us and we can quickly deep dive into that to assist in resolving that.
Yeah.
Great, thank you.
Okay, good stuff. Great. Then, Tukos, if we can take the next colleague, please. That is SAHPRA.
Good morning. I come from a private hospital pharmacy group, and I think it was rather unprofessional of SAHPRA not to have had any training prior to the launch of the new website, because I've been waiting for 4 drugs to be authorized and we've had quite a few problems with it. I'll just hand you over to my senior pharmacist as well.
Hi, good morning.
Morning.
One quick question is that I will actually manage you to open a register account under one of our doctors and then applied for one of the items that we urgently need, which is magnesium sulfate. So the one thing we always stuck on or getting confused was the SMH number for the respective companies that's registered, you know, the one that responds to export the item for us or import the drug for us rather. Is it not possible to get a list of all the companies, for example, like Lamar? I know Equity sent us an email with the SMH number. Is it not possible to have a list with all the companies that register with you guys that have such numbers included, the SMH number, there's some registration number they asked for it as well. That's question number 1. And then there was another question is that towards the end of the application, they asked us, it was, I think, under the particulars of the patient, that you had to put, there was a reason why did we not choose any medication that's not registered with SAHPRA. And then one of the options was to choose the medication and all associated generics are out of stock, if I'm not mistaken. And then there's the very bottom one that says upload out of stock letter as proof. And we can't get past that without uploading a document. Now, not always we'll get a out of stock letter from the supplier when that particular item's out of stock. Usually takes about a month and two. So now how do I bypass that step while waiting, if I don't have the out of stock letter? Those are my two questions.
Thanks, colleague. So I think with regards to the out of stock letter, that would be a requirement. Shamli, I don't know if you want to comment on that, but that documentation is required for us to process the application and approve it.
I couldn't get past it. You know, sometimes, which happens very often, the supplier will tell you items actually out of stock. But now that for them to get that letter, it's not always immediate. They maybe take 2 to 3 weeks. But now we need, for example, max sulfate. It's a necessity drug for bypass patient. I can't wait 2 to 3 weeks. So what is there a way to bypass that so I can get the item while waiting for the out of stock letter?
Yeah, maybe before we go to the other question, Shamli, do you want to maybe just comment on that? Is
Yes.
what mechanisms is available to the colleague to facilitate his application?
Okay, so we have also picked that up in that not all of the reasons, center around being out of stock, out of the registered product being out of stock. So we have brought this up with the developers, and they are.
So
we've been
the
told that
question
they're
is,
working.
sorry, Shamli, the question is, if the letter isn't available, what is your process? How do you verify that thing is out of stock? Do you have a different mechanism that you confirm this so that those applications that come in without this document you can process? That's the question.
Yeah, without uploading that document, it doesn't
Yeah,
let me
because
pass on to the
he's
next
not going to
step.
get his letter for at least a month. So how do we
Yes.
help him?
So if we have another application that came in with the out of stock letter, then we kind of refer to that, and we then allow it through, but we actually have to attach it to the application. But we do, if we have a previous application, then we will have access to the out of stock letter. So it shouldn't actually hold them back in terms of submitting the application. I'm sorry, I also got that they were not able to proceed further if they don't attach something, right?
Correct. It doesn't allow you to go on the next step.
Yeah, so we brought that up with the developer, and they're working on it.
So it's it's flagged as mandatory, and you're saying that it must be flagged as optional.
Yes, optional, because not all the time is it an out of stock scenario. There are other reasons where perhaps other documents might need to be attached.
Okay. Sorry, colleague, and just to go back to your first question, if you can just run us through that one again.
It's when I was doing the application itself, when you put particularly the company that importing the item, they ask you for,
right.
you know, you put
That
the mark,
SMF number.
the SMH number, and then also if you don't have a number, it's required. It won't let you pass on to the next phase. So is it possible to get a list with the company that's registered with you guys with all these necessary numbers, such as SMH number, the good manufacturing, the body? They ask a lot of these questions, which is not really included in the pamphlet that's sent by you guys. And now all those clause must be filled, otherwise we will not let you go to the next step.
Yeah, so I think with the site master file numbers, that typically the organizations that you would use to facilitate your import, you've mentioned one of the organizations has given that information through to you, so they would have
applied us. Yes, absolutely.
Okay,
not
all right.
others.
All right, so they would have that, and they should have that. If you are ordering through them and they are your import partner, they should be giving you this information. At the moment, I think we just have that drop-down list where you can search for it. But we can certainly look at perhaps sharing that list I think for the entities that we are aware of that is facilitating the import process for our Section 21 products.
Right.
As a reference list or a lookup. As for GMP numbers, again, your importer or the company
The
that's
company
responsible
itself.
for bringing the stock in, they should be getting this information. Because the GMP certificates that are required for the submission is also something that they should be I think assisting us with, or assisting you with, so
Okay.
that GMP number is also then something that should be on the certificate, and therefore they should be able to give that to you as well.
Right. I'm so sorry for holding up the queue. I'm sure there's other questions. That's one
No
more
problem.
quick question before I go. Was that also during the application process, there was one under particulars of the patient, if I remember correctly, which they asked for the ICD-10 codes for what we're treating, the condition that we're treating for. Now, just in case, for example, if I'm applying to application for multiple patients, just say 5 patients, now yet the application or either treatment diagnosis different for each different 5. Which one will I choose in this case? Or can I just use the standard ICD-10 code? It will work for all of them. Or does it really matter? Can I choose any, just say standard 076.9, for example? Will that go through as well? Do we have to be very specific now for each different patient, since we did a multiple, it's intended for multiple use for different patients?
Yeah, if it's for the same treatment indication, that would make sense to bring in
Yeah, but if
applications
it's not
for
the
that
same treatment,
indication. But
this is what I'm kind of concerned about.
yeah,
Yeah.
but if you've got let's say 10 patients that you want to apply for and 2 of them have got a different indication, then you should be submitting a multiple patient application for 8 of those within a specific ICD-10 code, and the other 2 needs to then be on their own application, because it's and again,
So,
I will
so we
defer
have
to
basically send them separately, isn't it? If you have 2 different ICD-10 codes. So
yeah. If because there would be different outcome reports then that would be expected for that, and different considerations in terms of the concomitant diseases and other therapies that they might be on, that might require the Section 21 unit to actually assess those applications slightly differently.
Thank you so much.
Okay, just one
Okay.
question before we go. From our side, I think it was absolutely unfair that you guys totally erased all history of our applications with SAHPRA, because you are the only regulatory body that's being used in South Africa. And as a hospital pharmacist manager, it makes absolutely no sense, because there are at least 5 or 6 drugs that are absolutely out of stock in the country, and these are used month in and month out by our patients. So is there no
Sorry,
way?
colleague. So can you just clarify what is the question actually? Do you want to know
Is there
what
no
happened
way
to your
that
data? Do you want what is the
what
purpose of
happened
the
to
legacy data?
What happened to the data? Because these drugs are consistently out of stock. What happened to the data? Is there no way that it can be recalled for our specific hospital? And then based on that, there should be some ease in terms of application.
No, we have got 2 different software platforms. And I think as we've explained in the previous webinar, the old platform that was used, we could not migrate that legacy data. Therefore, the applications that was logged on the legacy system, we completed, we concluded, and that system now is internally archived. For new applications, it's a one-off process to then register your account and log your request. And thereafter, that history remains for you to do reauthorizations or reapplications with.
Okay,
Thank you.
thank you.
Sure. Ingrid?
Hi, Kristalna and Dr. Shamli. Thank you for the opportunity to ask a question and for the webinar. I have 2 questions, and I think one of the previous speakers already touched on that, and it might be a little bit more procedural. One of the things is regarding the out of letter. So previously, Dr. Shamli would have reached out if there was out of stock, and we would have provided that, or even the hospital group would have reached out. So my question, I wasn't clear on that. Will that process still be the same? Would it be for the hospital group or the HCP to reach out to us as the manufacturer for that out of stock letter that we will provide? But then the second question regarding that is, what do we do if stock is back in country? Because we've got a concern where if the stock is back, and I'm not talking about the big emergency things, how do we prevent that the Section 21 approvals continue without, us having the opportunity to bring in our products? So that's our first question. And because what we've seen is that a lot of generics, unregistered generics, do come into the country where the innovator is registered, and we're not quite sure. And I'm happy to take this offline as well. This may be a little bit more procedural. Then the second question relates to the site master file and the GMP license. We received a lot of queries from IPASA companies regarding proprietary information, etc. And I was wondering if there's any workaround where we can provide that information directly to SAHPRA rather than sharing the GMP licenses with, a lot of healthcare professionals, because they're all, private information, our cell phone numbers are on those documents. So just a question, and that's it from my side. Thank you very much.
Thanks, Ingrid. So, I mean, I think you've asked two very good questions. So, maybe it would be good to actually engage with the applicants, Shamli, to just discuss this mechanism of confirming out of stocks. Perhaps more a activity that should be aligned directly between SAHPRA and the respective applicants. And I mean, Ingrid, to that point, then it allows for us to create a mechanism where we can get confirmation, positive confirmation, and also then be alerted as soon as a particular stock item is back in stock and is available to the market. In terms of the GMP certificates, Shamli, just a bit of clarity from my side on that one. GMP certificates that used to come through before? Not a new requirement?
Yes, no, it used to come through before, and it was just purely the
So-
GMP certificate. So it doesn't have too much of confidential information. It's just the certificate itself with the manufacturer's details, which authority has actually granted that GMP certificate, and for perhaps which manufacturing line they've looked at, and so on. So it has come in before, but if it's just the certificate, then I think we shouldn't
But
really
that's what you're
be
currently
worried.
asking for, right?
Yes,
Yeah.
yes, that is true.
Okay. So Ingrid, yeah, maybe we can just step through that application process, because it is the certificate that used to be submitted before, except for not uploading the certificate, but then also just capturing some of the metadata in the application that comes off the actual certificate. So maybe just to understand some of the IP concerns around that, but we can unpack that perhaps in a contact session.
Thanks, Kristalna and Dr. Shamli. I'll send you guys a separate email with that, and you guys can decide then if we need to take it further or anything. I appreciate it. Thank you so much.
Okay, good stuff. And then a hand from, let me just see who is next. Isa, Ali.
Good morning. I'm actually from the Gauteng province, public pharmaceutical services in the public health space. I just wanted to check if this changes were communicated to the principals in the public health space across the provinces, because we were starting to get some complaints this week from our hospitals regarding struggles with the application process. And I just wanted to check if it has been communicated, because perhaps the contact detail for the head of pharmaceutical services in Gauteng is not right, just so that we could set it right so that we can get further, we can be updated. That was just my only query. Thanks very much.
Thanks very much. I think that is something that probably would be helpful is if we could have all of those contact details. So when we have contact sessions or webinars or briefings, that we do ensure all of the right people are alerted and receive the links and then can be updated. I'm not sure if you have my email address. I'm going to pop that in the chat. And I'm happy to then just receive from you the key contacts that we can add, and I can also then just share that with our communications unit. And whether that's just for Gauteng or more broadly across all of the different provinces, I would be very happy to receive that indeed. Thank you.
Okay, thanks. Now, if you pop in your email address, I will email you the Gauteng people. And I will share it with my manager. They have regular HOPS meetings in all the provinces. Perhaps you could also share your email address so that all the provinces can be in touch with you. Thanks very much.
Thanks very much. I'm going to put that in the Q&A section now. If you can just pick it up from there, and then I will look forward to getting your email. Thank you so much. Sorry, let me just type that out quickly. What did I spell that right? Yeah. Okay. Right. Okay. So it should be there. Great. Let me just go back to hands. Let's just see who's next. We've got a hand up from Kathy. Tukuza, can you just help us there with unmuting Kathy Baird for us? Or enabling mic, should I rather say?
Our mic is enabled, Christina.
Good stuff. Kathy, then if you can unmute on your side, so we can just take your question. Alrighty. I think maybe whilst we wait for you, let me then just go to the colleague that is next on the list, and that is Janine Farr.
Hi, Christelna. Can you hear us?
Yes, ma'am.
Yes.
Yes,
Okay.
we can.
I'm calling from the Melamed Private Hospital Group, and we do appreciate that your systems, it takes a while to refine and develop the systems. However, we are in need of urgent medication that we need today. So what is the process that we can follow to get that medication urgently?
Janine, have you guys managed to log an application yet? Is the application with us? Is it in the system, or is this more where do we start? How do we get the account created, and how do we quickly create an application kind of question?
So we have tried to log an application, but we have not been successful. We've really struggled. So yeah, that's where we are at this point in time.
Okay, Janine, can you maybe just granulate? So when you've logged onto your account and you said that you're just struggling to log the application, is there specific how can I say, error messages or specific issues that you pick up during the application process? It's obviously just helpful for us to understand how to fast track the troubleshooting around this.
Yes. So one of the challenges is the pricing that comes up. It just looks very excessive.
So are you trying to apply for one of these multiple applications?
Yes, that's correct.
Right. So that is currently the pricing structure that is in place for multiple patient applications. And I think just to take us back to the feedback that I shared in the slides, one of the things that we are busy assessing is just to create a third pricing structure for applications that needs to be for hospital stock or stock items that you would typically use for emergencies or one-off. If it is one of those, then I would suggest that we maybe just have a contact session with you after. Unfortunately, this is the current pricing structure. So if there is anything very urgent, that needs to be something that we will have to assess then on a case-by-case basis with you. We still have to go through the process of getting formal alignment and approval for a change and introduction of a third pricing tier, and that only will happen next week, Tuesday. So yeah, I mean, it sounds like you are in more pressing need than having to, yeah. So unfortunately, I cannot offer you an alternate at this stage, other than the application that needs to be processed for now, for whatever quantity it is that is then emergency. That quantity probably would be my best advice is order that quantity for now. And I think once we've got alignment and approval for that revised third-year pricing structure, if the remainder of the quantity could then be applied for in a second application.
Okay, thank you.
Right, then we've got Kathy and then Anthea.
Hi, Christina. Thank you very much for the update. I have a query to Dr. Moonput, just in that there are a lot of items registered on your database as saying they're registered products and they're current, but a lot of the suppliers have them dormant, so they're not available. There's no out of stock letter, and sometimes the company doesn't exist anymore, like Garrick Pharmaceuticals. And then we sit with the situation where we cannot get past your blockage in terms of out of stock letters, talking back to the previous chap who was talking from the private sector. So it is a problem. And I do believe that portion of your registration is going to get sorted out with the renewal of registration, but that's going to take 5 years to get there. So is there not a way that you guys can contact these, I don't know where they are anymore, companies, because it's very difficult to get hold of a contact. I mean, I've been in the business a long time, and Garrick was around many, many years ago. And yeah, you just hit a roadblock when you have to try and find an out of stock certificate for something that's registered, but there's nothing around. And if you dig and dig and dig, you eventually come up with whoever took over the product, but they haven't done the transfer, so it's not updated on MediCredit. It's very difficult to find these people and to find a contact where that is the case. So I'm just asking that there's some leeway, especially on the weirdo companies that no longer exist.
Yeah. Yeah, Anthea, I think that's another good piece of feedback. Thank you for also flagging that. And indeed, I mean, that I think is a similar challenge that our colleagues at the National Department of Health also raised when we started having discussions around implementing renewals and health product renewals and what needs to be done with dormant products. They also expressed similar frustration around sometimes, even they might encounter an out of stock situation, looking then for alternatives, contacting those companies and actually finding that the products, even though registered, is not available. So I think somebody let us just have a offline discussion, because that sounds like it is something that we should internally figure out how we are going to manage that and support industry then, so that it doesn't become a blockage.
Okay,
Yes,
then
we can
there's this.
certainly look at it internally, Anthea.
Thanks, Sonia.
Yeah.
There's another scenario that also comes in. For example, the supplier only brings stock in for the state. So it's registered. There's now a stock letter, but it's only for state use.
State use, yeah. Okay. So
So
it's the state use as, yeah.
Private sector can't access, and then it becomes a challenge for us.
No, fully appreciate that, because I mean, technically it's not available for you, full stop. Okay. All right. So dormant products and state use only products. Okay, I've made a note of that, Anthea. We'll have a look at those scenarios as well. See, maybe that means that there's a fifth category that we need to just accommodate for.
Okay, great. Really appreciate.
Yep, no problem.
Thank you.
Colleagues, then I do have to ask, please, I note that I'm being signaled to step into this other meeting. Let me just quickly see if we can maybe do one or two more questions before we dash. For everybody else that had a hand up that we are not going to be able to get to, may you kindly just make sure we've got your question in the Q&A section. I am for now please going to ask that we take a question from Sharoch and then Kumotsu, and thereafter we will close the Q&A section, the discussion section, and then I will pick up the questions in the Q&A so that we can perhaps schedule that feedback post our internal management discussion next week Tuesday, maybe just reconvene with you next week Wednesday as well, so that we can then give you feedback as well as also run through some of the other questions that was on the Q&A, please. So let me come through then to Sharoch.
Dr. Nawa, perhaps you should unmute.
All right, whilst we're waiting for the colleague.
Muted now?
Okay,
yes,
we can
yes,
hear you now.
All right. So from a practical point of view, I'm a very pragmatic person, and so SAHPRA should also be. It should be an operational, functional entity to facilitate the end product, which is the patient. All right. So at the end of all of these discussions, the patient is the one that suffers here. All right. So if I do an application, I expect an answer within a few days. I did my application on the 4th of April. We are now 10 days later. I've not heard anything because it's absolutely impossible to interact with any people from SAHPRA. Even I had to do a refund because there was a mismatch between the reference number of the payment and the reference number of the application. Then I had to do an affidavit. Can you believe in an affidavit to get this refunded into my account? I'm still waiting for that. So look, we have got absolutely no use of SAHPRA if you guys are continuing beating around the bush and making this platform, Section 21 portal, absolutely user unfriendly and dysfunctional, non-operational.
I'm sorry. So I appreciate the feedback. Was there a particular question that you wanted to ask, or is there any specific assistance that we can give you with facilitating your process?
Yes. So why did SAHPRA change their portal, which was functioning before? It was smooth running. There was no issues with it. Why did you fix a platform that was functional and has now become completely dysfunctional and non-operational? What is the reason for this mess?
So the platform is functional and it is operational. It is different though, because there is increased regulation. So if I may just have a chance to respond, please. So we have increased the regulatory oversight that is being exercised over Section 21 unregistered products that come into this country. And this on the back of numerous discussions that we've had with our Technical Oversight and Regulatory Strategy Board Committee, as well as from the SAHPRA board themselves. There is a concern around the significant number of Section 21 products that is coming into South Africa at the moment. And there was a requirement for us to align and benchmark with other regulatory bodies across the globe. And I've mentioned some of those at the start of the presentation. We have looked at their applications processes. We have looked at their different applications online portals, and we have updated our new development space so that it then mimics best practice. And it is in order for us to also take the patient care at heart and to prioritize regulatory oversight and to prioritize the patient. So that is at the end of the day our aim as well. But it does mean that there are some changes that needed to be introduced. And I think what we are trying to do is to best facilitate communicating and also aligning and educating the members that use the platform to the new requirements and facilitate constructive discussions so that we can make sure that everybody starts to onboard and adapt to the new processes and the new requirements that ultimately addresses some of the needs that have been expressed from the TORS and the board itself.
Christelna, we wouldn't have this discussion here with 352 people present in this meeting if your system would be operational. Your system does not function, and I don't know how I can get it across, but none of the staff members is able
again,
to...
respectfully...
Can I now finish my sentence? Can I please finish my sentence? I am still waiting for my refund. With other words, the operations itself are not working. I cannot move one step further if you guys are delaying the process. If you guys are not reverting back to the previous portal, we will have such a huge backlog that the patients will drop like flies, only because you can't get your bloody function, your operations straight. I mean, this is absolutely crazy. Patients are already dying because they are not getting Section 21 medication, because no one can do an application. It's not working.
So yeah, we welcome the feedback and happy to put you in touch with some of the applicants that have successfully managed to get their applications in, get them processed and approved.
No one has been successful.
Thank you, sir.
No.
If I can please move to Komoto and take input and questions from there. And then colleagues, I will have to ask that we close this session. Komoto.
Hi, Komoto. Hi, sorry. I'm just speaking on behalf of Komoto. It's Sajal, a pharmacist here at Lifeaways Hospital. We were trying to load an application for the use of chloral hydrate, which our pediatricians use when the children go in for MRIs. But at the moment when I was doing this, I was stuck on Section D because the manufacturer of chloral hydrate, which was approved previously, is not loaded on the system. So Odin Laboratories is not coming up. As a result, we have no SMF number. And further, it's not allowing us to load the country of origin, etc., that we need to complete that application. So that was the first point. And the second point was they're asking us information on the API details, which the companies cannot provide. So it was never a requirement previously, but now they need us to provide details on the API plus costing, which we don't have available.
Komoto, sorry, you said you are?
Kajal.
Kajal. The company that's doing the import on your behalf, who's facilitating this, and do we?
It was Equity Pharmaceuticals.
And they don't have this information.
I've requested it from them, but they couldn't supply it. So even the GMP Odin Laboratories, it's registered in Canada, and Canada doesn't give out the GMP to the public.
Right. So, I mean, I think because the requirement for GMP certificates have been something that's been there before, I would imagine that Equity had mechanisms to get the right information and get the right supporting documentation.
They did give me whatever they could, and I uploaded that as supporting documentation. But Odin itself is not loaded as a manufacturer. So unless I load Equity as the manufacturer.
No, it needs to be the actual manufacturer of the product, because the site where the manufacturing takes place needs to be SAHPRA approved.
Okay.
Shamli, I don't know if that is correct, but that's how I understood you guys doing your assessment, that the GMP
Yes,
site
it's
needs to be
correct.
approved, and therefore if
Yes.
Odin is not on the list, they may not be an approved site per se.
But we were getting chloral hydrate previously from Equity, and we still have a
No,
box.
from Equity, yes, I understand, but was it from the same site?
Yes, it was. I looked at the
Okay.
previous application form.
Okay, 100%. Shamli, can I ask you then to connect with the team at
Kajal.
Life Fourways? Yeah,
Yes.
because I mean,
I
if
will.
you've previously approved this, then surely there must be something that you guys have got on your registry that can assist them to get the
We'll
information.
work with Kajal and Komotso.
Great,
Okay,
great. Can
And
we,
does that go for the API information as well? Where are we supposed to get this from?
yeah,
Because
that would be chloral. That would be the chloral hydrate. That would be the active product or active pharmaceutical ingredient.
Yeah, because the information that Equity gave us, they're asking for the product code for chloral hydrate or whatever that's not on any of the documents that Equity supplied us with.
I can see how we can assist you with that, looking at your previous information.
Yeah, Shamli, if you could, and also loop back to me, I think it's worthwhile having a discussion with Equity after this.
Sure.
Thanks. All right. Thanks.
Thank you.
Sure, 100%. I will ask Shamli to prioritize that contact session with you so that we can get you on your way before the afternoon sets in.
Oh, we'd really appreciate that. Thank you so much. So we'll wait for her to get in touch with us then.
Yes, please. I think, Shamli, you will reach out telephonically, please. Even if it means that we have to quickly set up a Microsoft Teams session. Those work really, really quite well.
Yes, I'm going to contact them now and
Great.
arrange a Teams meeting.
Great. All right. Good stuff. Team, then thanks very much for joining the session. Also, colleagues, thank you for joining the session. Appreciate the input and the feedback, and look forward to continuing to receive your input. And we will then reschedule a feedback session for next week, Wednesday, to then just give you that update on the outcomes of the internal management discussions. Thank you.
Thank you, everyone.